The choice could not be clearer. Liberals won't reward big polluters, gun makers, and the wealthiest 1% with a tax cut, but the Conservatives will. They always do. And the fine print? Well, they'll pay for it by cutting the public services you and your family rely on. You can set your clock by it. Exhibit A, Doug Ford. On the campaign trail, Conservative politicians love to say they're for the people, but we know what happens once they're in office. Families here in Ontario have seen just how far they're willing to go to help the wealthiest few, how quickly they will make cuts to public health and to the services people rely on most. They don't understand that you can't cut your way to prosperity. Doug Ford threatened cuts to Ontario's autism program. He cancelled an out-of-country OHIP program. And he cut Ontario's pharmacare program that was focused on the needs of kids and young adults. Rewarding the wealthy and big polluters and making life harder for the middle class. That's what Conservative politicians do. And now Andrew Scheer wants you to double down on Conservative politicians. Twice the tax breaks for big polluters and the wealthy, and twice the cuts for you and your family. There aren't enough teachers offering courses in Ontario this year for grade 12s to put together the credits they need to graduate. Think about that. That's what happens when a government focuses on buck a beer. I'm not for doubling down on the Conservatives. I'm for moving forward with you. That's why we decided to invest in people and in their future. And we're off to a great start. But we also know there's a lot more work to do. Like many Canadians, I'm proud to live in a country where we have universal health care. But I also know that our system is not perfect. Right now, too many people are falling through the cracks. Parents and children who have to spend the night at the ER because they don't have a family doctor. Injured workers who can't afford the medicine they need to get back on their feet. Teenagers struggling with mental illness who don't know there are professionals who can help. Widows who can't afford home care. The list goes on. And in a country like ours, that's unacceptable.